Last evening, and I have friend and colleague from Maastricht University, Fons. Some of you will have heard before. Fons is the head of the Center for Human Rights at Maastricht, and the professor of law, human rights law, and a collaborator on our work, particularly around the right to health and participation. So it's very nice to have Fons here again. And Fons is actually co-supervisor in a student on the right to enjoy the benefits of scientific progress, which is a topic you would have heard me speak about before. Anyway, today he's talking about the Sustainable Development Goals from a human rights perspective, so looking at achieving the right to health through the Sustainable Development Goals. We might have some visitors coming in from the Climate and Health Forum, so bear in mind it's 2 billion of little, but I think it's so thanks, Fons.
Okay, thank you. So, indeed, it's a pleasure to be back. Yeah, I was just telling Leslie and Marion, so the last time I was here was May last year. And now I'm only staying for a couple of days, but I promise next year I will be back for a longer period, so then we can have more discussions on substance, on topics that we have, in which we share a common interest. Okay, so I will talk today about the relationship between the Sustainable Development Goals, and especially the one on health, and human rights. And that's a kind of a little bit of a strange relationship, because the Sustainable Development Goals and the Agenda for Development, the well-known document that was adopted in 2015, transforming our world, the 2030 Agenda for Sustainable Development. That is not a human rights document. It is mainly a policy or political document. And there is little attention for human rights issues. And I think that's a pity. I think that the Sustainable Development Goals, in particular also the one on health, can be implemented, should be implemented through a human rights-based approach. And I will give you some arguments for that, and also a couple of examples. The SDGs, they are an important political document. There is no doubt about that. And it was agreed upon at the highest political level among heads of states, head of government, back in 2015, to give follow-up to the Millennium Development Goals. And I would say, indeed, compared to the document on the Millennium Development Goals, this document is better. It is not only about, let's say, development in the south, it's also about development in the north. So there's now more of a balance in terms of attention for particular topics. It is ambitious because a lot needs to be done, but, and that is one of the weaknesses, the Sustainable Development Goals, the Agenda for Development, does not tell us how these goals should be realized, how they should be implemented. That's one of the weaknesses, and I will come back to that. But the main perspective for the presentation today is the relationship between health, which is SDG number 3, and a human rights-based approach. So SDG number 3, very briefly, the goal is to ensure healthy lives and promote well-being for all at all ages, and in particular, that's important, leave no one behind. The clause "leave no one behind" is running as a red thread through the whole document, so that's important. While the right to health as a human right is the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. And that is drawn from the International Covenant on Economic, Social and Cultural Rights, which is the most important human rights treaty to which South Africa is also a state party. And I think most of you will know, at least that's what I hope, that last week in Geneva, the first report by the South African government on how the government has implemented the Covenant on Economic, Social and Cultural Rights, and so also the right to health, has been implemented. That was discussed by the United Nations Committee on Economic, Social and Cultural Rights, which is called the treaty body. And we are still waiting for the, what is called, concluding observations. But there was indeed a very interesting also challenging discussion between committee members and the representatives of the government of South Africa. And the committee also based itself on information that was provided by a number of NGOs, like the People Health Movement and some other. Yeah. And this kind of information is seen as alternative information next to the information that is provided by the government. So we still have to see what the opinion is of the committee about the situation of social and economic and cultural rights in South Africa, in particular the right to health. But for our discussion today, what is interesting is to stress that there is overlap between the Sustainable Development Goal number 3 on the one hand and the right to health. So if you would compare, just by way of example, two targets that are drawn from the SDG number 3, namely target number 3, to end preventable death of newborns and children under 5 years of age, that is drawn from the SDG text, and the related Article 12, Section 2A of the Covenant on Economic and Social and Cultural Rights, which is the Human Rights Treaty, which is, the aim is, all states have an obligation to reduce the number of stillbirth rate and of infant mortality. So there is a clear link, overlap between the two provisions. Another example deals with target number 3, to end epidemics of AIDS, TB, malaria, and neglected tropical diseases, while Article 2, Section 12.2c of the Covenant, so the Human Rights Treaty, provides for prevention, treatment, and control of epidemic, endemic, occupational, and other diseases. So there is, and that's interesting, there is what we would call normative overlap. There's normative overlap. But the language is different. And language is quite important, and that is also, you can play with language. Politicians play with language because it serves some kind of political purposes, but also lawyers play a lot with language. So you have to very carefully interpret what is meant by a particular provision. And the most important difference is, of course, that these provisions from the Covenant on Economic, Social and Cultural Rights and the Human Rights Treaty, this one and this one, are framed in terms of obligations, not of aspirations or just goals, policy goals, but of obligations. And legal obligations that the state must implement because the state, South Africa in this case, has voluntarily accepted these obligations. That's quite important. So it's difficult to get away with it. Okay. So what is the relationship between the SDGs and human rights? As I already said, the SDGs are not a human rights document. It's a political or policy document, framed in nice political language, but that need to be translated into actions. And there are only occasional references to international human rights obligations. You may say that lip service is paid to human rights obligations that states have adopted voluntarily. There is a reference in the document that the implementation of the Sustainable Development Goals must be in accordance with obligations resulting from the right to health as a human right. Full stop. That's it. There's not more explanation is not given. But I would say that human rights law provides a normative framework and guidance for the implementation of SDG number 3 on health. So you can draw from human rights law elements, and I will explain those elements later on, how these goals, in particular the one on health, can be implemented. And that is helpful because the SDG document does not give any clues how this should be done. So why is there no reference to the right to health in SDG number 3? Now we are entering sensitive discussion because, of course, it was suggested during the negotiations that the agenda for development should also contain some clear explanations and references and interpretations of human rights law. But these suggestions were not successful because they were rejected by a number of countries, and there were some specific reasons for that. Human rights were sidelined, and that applies to all human rights, during the negotiations. Countries from the South thought that Western countries were imposing Western cultures and values on them. Health as a human right was considered as a contentious issue, giving rise to tough discussions. And that these tough discussions in particular dealt with sexual and reproductive health rights. This was rejected by a number of countries from the South. So there was no agreement to include that in the document. The second reason deals with the issue that an overarching 2030 right to health goal was seen to be too big to be specifically defined as a sustainable development goal and too difficult to implement. So governments argue, yeah, it is not exactly clear what we should do when we include the right to health in the agenda for development. What type of obligations, what type of entitlements this should entail. And of course, that is a kind of excuse, because it is very much clear what states should be done. Because there is this, I think most of you will know, there is this famous general comment, number 14 on the right to health, exactly explaining quite in detail what states must do with a view to realizing the right to health as an individual human right. So that was, you could argue this is an excuse. And finally, states were cautious about the explicit use of rights rhetoric in a political document. As I said, the SDG, Agenda for Development, is a political document. It's not a legal document, so it makes no sense, in their view, to talk about rights and include rights rhetoric. And rights rhetoric means that the emphasis, the importance of realizing human rights is very much stressed. But when you mention rights, it also includes that there is somebody else, usually the state, that has obligations. And governments are, and I think you know that, governments are quite reluctant to accept in a public top priority document that they have obligations. But in my view, and I'm quite skeptic about the value of the SDG document as a whole, and the question whether it has really value added to what already exists. So there are a number of weaknesses in that document that should be taken into account, and these weaknesses also to some extent undermine the implementation of the document as a whole, and that could also undermine the implementation of the Sustainable Development Goal number 3 on health. So there is no mentioning of obligations or responsibilities. As I said, there are a few references to human rights obligations, but only in a very general way, and no explicit provisions are given on what the right to health as human rights entails. So no mentioning of obligations. Secondly, there is, and that is also important, no division of labor. Who does what? So the goals are mentioned, and there is agreement on this, but who should do what? And in particular, whether states from the north, or rich states, or China, or Japan, or the United States, whether these states have obligations to assist other states in fulfilling, in achieving the Sustainable Development Goals. Who does what? That's not mentioned. So also governments from the north can escape, can find an excuse by saying, well, yes, the goal as such is nice, but we have not taken up any obligations. Maybe some moral obligations, but certainly not legal ones. And finally, there is no accountability procedure, only a review mechanism. So a review mechanism means that after a few years, states will sit together again and review what has been achieved. But that is something different from an accountability mechanism, accountability procedure, where states could be held accountable for implementing these goals. An accountability mechanism is usually also used when there are legal obligations to implement it. But, as I said, the goals are not framed as legal obligations. So, to give you an example from a concrete element or section of SDG number 3, paragraph 3 mentions that one of the goals is to provide access to affordable essential medicines and vaccines in accordance with the TRIPS agreement. Well, that sounds very nice, and probably everyone would agree with it, but who will do? Who will take up this goal, and who shall do? Who has obligations, for example, to make sure that patients in the south have access to affordable medicines? Does that also mean, for example, that states from the north or companies from the north should transfer technology to produce essential medicines in the south? That's not clear. This is the only reference, and in my view, it's not sufficient. So, what should be done then, in my view, to strengthen the implementation of SDG number 3? That is by applying a so-called human rights-based approach for implementing SDG number 3. And I have here on the slide a number of elements that could be helpful in making it more specific what should be done to implement SDG number 3 on health. And these elements are drawn from the human rights framework. So first of all, there should be a focus on the empowerment of right holders and responsibilities of duty bearers. So right holders means that individuals, and in particular, let's say sick people, are not just seen as consumers, but as right holders who have a right to health, and that would mean that if you have a right, somebody else has an obligation. And that is, these are the duty bearers. And usually that is the local municipalities, the provincial municipalities, the states, but also at the international level, other states or international organizations can be seen as duty bearers, who may have obligations when they have ratified international human rights treaties, or responsibilities for example, corporations. Pharmaceutical corporations do not yet have obligations, but they definitely have responsibilities under the international human rights law. Second element is that all health services, goods and facilities shall be available, accessible, acceptable and of good quality. These are criteria that need to be taken into account when the right to health is being implemented, for example, at the local level. I will give you a few examples later on. Measures must be non-discriminatory in design, operation and effect. Non-discrimination, equal treatment, is an important concept in international human rights law. And that can be linked to, first of all, to the notion of leaving no one behind. But it makes the obligations much stronger if you use human rights language like non-discrimination. Then there should be attention for the protection of vulnerable groups. Vulnerable groups, for example, patients suffering from neglected diseases must be included, and that is again related to the notion of leaving no one behind. Human rights law departs from the notion of including people instead of excluding people. That is another important element. Participation of individuals and communities in decision making, well, I think that is quite clear. It is part of the human rights based approach to include individuals about decisions that will affect them. For example, local communities, local health committees should be included in decisions about issues that are relevant from a health perspective. Information and transparency in decision making on health issues, that is also one of the basic underlying notions that applies in the human rights based approach. And finally, monitoring and accountability mechanisms at the national, regional and local level. So it's not just enough to have all these nice documents that states have adopted, but you should also be able to ask them, well, you have adopted, you have signed up to these international documents, what have you done to implement them? It is not free of obligations. Okay, then let me give you a few good practices. These are drawn from a document that was compiled by the United Nations Office of the High Commissioner for Human Rights in Geneva. Between brackets you see the elements of the human rights based approach that is applicable here. And there are a few examples also from South Africa. So these are not my own examples, but these are drawn from a UN document. So the first good example is the integration of human rights and ethics into training of HIV/AIDS testing in prisons provided to doctors, dentists and psychologists. This is an example from Morocco. It deals with the protection and inclusion of vulnerable groups, people living in, staying in prisons. Second example is the development of training materials for health personnel to address stigma and discrimination in health services. Again, relating to vulnerable groups. This is also important because it deals with how this health personnel should be trained in when they treat vulnerable groups in health centers. Third example deals with a national HIV plan aimed at reducing infection rates, discrimination and stigma by providing information, psychological support and treatment to members of the LGBT community. This is drawn from, this is a South African example. It's about accessibility of health care services, which is another element of the human rights based approach. Accessibility for people that are, again, are in a vulnerable position. Next one is about establishing the people's health insurance scheme, offering universal access to a comprehensive package of personal health services with financial protection, which is about availability and accessibility of health services, but also a system that is affordable to all, so that provides also financial support for people who are unable to pay for it. The training of healthcare staff and introduction of healthcare protocols which target on indigenous women, reclaiming traditional practices of indigenous midwives, which is about the cultural acceptability of healthcare service, which is indeed a very important issue, something which is less important in the north, but very much important in countries from the south. And a final example deals with the training of mothers living with HIV as mentors, supporting and advising pregnant women and assisting them with access to services to prevent mother-to-child transmission of HIV. This, I think, is the well-known Mothers to Mothers initiative from South Africa, which is also being implemented in other African countries. And it very much focuses on stimulating community participation. Okay, finally, to conclude, the SDGs are, as I said, an important step forward when you compare it to the Millennium Development Goals. But, and I've said, there are a number of weaknesses, and these weaknesses can only be overcome when there is political will to accept and translate the realization of SDG number 3 on health into a matter of implementation of the right to health as human right, for which authorities can be held accountable. It's not free of obligations. They have to do something to implement something that they have voluntarily accepted. And this can be framed as legal obligations that they have accepted as state parties to human rights treaties. Rights of individuals imply duties for government authorities for which they can be held accountable. And I think that is the most important conclusion, that the policy goals, the SDGs, sound nice, but I think they can be strengthened when the human rights-based approach is applied. Thank you very much.
Thanks very much, Fons. A very clear and stimulating presentation. I want to welcome the College Health Forum here to come up and course. So we open it up for discussion, questions, comments. Anybody want to go? Andrew.
Thank you for as you said, a very clear and concise presentation. And I don't disagree. I don't think anyone would disagree with the importance of human rights and implementing the SDGs. But what you've said, it sounds like the fundamental problem of the SDGs is the lack of obligation.
Yeah.
And it's impossible to engage with human rights or any other framework to implement unless implementation is part of the obligation of the.
Yeah. Otherwise, it makes no sense. Yeah.
Was that the case with the MDGs as well? And is that common? The
MDGs, you mean? Yeah. I think so. In the MDGs, that document was even less attention for human rights. It was mentioned even less than in the current SDGs. And also, I think human rights NGOs and civil society organizations were less insisting or pressing governments to include human rights language. So the NGOs and civil societies organizations have learned from the MDG experience, and they have tried to include, let's say, more rights language in the SDGs, but they were not successful. An organization called, NGO called the Center for Economic and Social Rights in New York and Madrid in Spain, they have been very much pushing and lobbying governments during the negotiations to pay more attention to human rights language and to use human rights obligation language in the document, but they were not successful.
I think Daniel's question is the MDGs were featured quite prominently. Our government would report on progress to the UN on MDGs. So there was no punishment.
But it felt like there was some sense of obligation.
Yeah, so there was some sort of accountability.
So I'm wondering, is that a real difference?
But then I would say South Africa is the exception rather than the rule. Yeah.
Okay.
So in my country, the Netherlands, the SDGs indeed have much more attention than compared to the MDGs 10 or 15 years. Why? Because it's not only about governments, it's also about, let's say, other actors, non-state actors. Corporations are very much involved in the Netherlands in trying to implement or at least to get involved in discussions about implementing the SDGs. I don't know whether that is the case here in South Africa. Corporations. Okay.
Marion and David and then Marion.
The talk about leave no one behind.
Yeah.
If I may say, it sounds to me like World Health Organization hot air. But nevertheless, I just think it's a big challenge for epidemiology because a lot of these are hidden groups.
Yeah.
They're not easy to measure. And unless you measure them, nobody takes any notice unless they're numbers. And I'm not sure I think we need to maybe take that a little bit more seriously. They will acknowledge numbers as measures of accountability. The review, so what if you don't get, I think it's obligation again, so what if you don't show change? And what worries me as well is we'll go round and round and round in the same groups, but there are a lot of groups that haven't yet made it onto the agenda.
Yeah.
It's the first time ever that disability is mentioned. Health for All by the year 2000, I actually happen to remember. Then there was the Millennium Development Goals, and now this is the first time ever. So there are other groupings that we haven't found yet. So that's what worries me. It's going to go along until 2030 and people are still getting it.
But you mentioned you had another question?
No, that's it.
Okay, so you mentioned disability is now mentioned for the first time. So do you think that is a step forward?
Yes, I do, but how seriously they'll take it, and we've got numbers, and we know numbers for disability.
Yeah, and also disability is the let's say the umbrella term. There is no specific information on other, as you mentioned, other specific vulnerable groups like deaf people, blind people. It's not mentioned, and that would have been a big step forward if these separate groups would have been mentioned, but that's not the case.
So epidemiology starts to take the hidden groups more seriously, then I think, and work out ways for representative sampling. I would hope that they'll take it more seriously. Numbers are meaningful.
Yeah.
Policy.
So how this can be strengthened? I think in my country, for example, there are local initiatives where these sustainable development goals are taken, for example, as a basis for local policies, and that would create an opportunity for civil society groups or social fora to voice their concerns and to hold also local authorities accountable, and also try to include these special vulnerable groups in issues about decision making on health issues at the local level. Because I very much believe in this bottom-up approach, so that citizens organize themselves, look at what kind of possibilities, what kind of options do these SDGs create for us, and how can we use them to hold our policymakers accountable. I don't believe so much in the top-down approach, where the central government just tells us what we should do.
So in a way, I guess the Untitled Health Forum wanted to use this to engage with the health service.
Maybe, yeah.
Might be a way to could be organised. Okay.
Thanks, Fons, for the talk. And I agree with you. I think that your emphasis on hopefully engendering political will through pressure from below is absolutely central. So you focused on SDG 3,
yeah,
which is the one on health. But actually the right to health, as you well know, depends on much more than health care. So SDG 2 is about ending hunger. SDG 6 is about water and sanitation. And there are several other SDGs which have a very, very important impact on health.
Yeah.
So one of the really worrying things for me and actually for People's Health Mission is that SDG 8, which is about economic growth and development, if you read all of the clauses, all of the targets, and there are 169 targets, 17 goals and 169 targets, if you read SDG 8, it proposes absolutely no change in our current global economy.
Market-based.
Yeah, extractivist based, actually.
Yeah.
And it calls for 7% GDP growth in the least developed country. So, if there were no change in the current power relations between the rich countries and the poor, a writer who's called Jason Hickel has calculated that it will take 165 years to reach the SDGs and require 3.4 planet Earths. So, unless the economic paradigm is changed, actually, sustainable development is not possible.
Yeah.
And I feel that we in the health sector shouldn't just be focusing on SDG 3, which is about health care. Of course, that's important. But SDGs give us an opportunity now to actually seriously analyze what it would take for the right to health to be guaranteed. So we need to do a big educational job in our own constituencies, and we need to press governments, especially the big powers, about what kind of economic development paradigm. Because if we continue to follow the same line, actually we're all doomed.
No, you're absolutely right, and I agree with your observations. Indeed, this document, the Agenda for Development, was definitely not meant to restructure or suggest a totally different economic order. It's the market-based economic order from a very strong trust in the good things of economic globalization. That's clear, and it's also clear that the more powerful actors, in particular the big transnational companies, will definitely benefit from these kind of goals. They were also involved in some ways in agreeing upon during the negotiations. It was not only about governments, but governments were of course lobbied by other actors, like corporations, like civil society organizations and NGOs. But these transnational corporations are of course much more powerful in influencing outcomes than civil society organizations. Your second observation about it's not only about health, but also other issues like water, food are relevant. That is indeed also very much possible to apply a human rights based perspective on this. It is well known that in human rights debate. There's a lot of emphasis on the fact that all human rights are interrelated and interdependent. So, for example, a person who is well educated is also much better to lead a healthy life, or much better able to find a job. So all these human rights, education, work, health, food, water, are related. I think that is something which is also perhaps mentioned in one sentence in the document, but it should have been given much more attention. And then finally, your observation about sustainability. What is the meaning of sustainability? Is it only about, let's say, economic issues? And if we talk about sustainability, if we put a timeline on it, when does it end? When are we talking about a period of 50 years? This is until 2030. So that is a little bit more than 10 years from now. I'm now involved, and we have just started this year with a new research project in Europe about something which is also from a legal perspective not easy. That is the human rights of future generations. Not human rights for future generations, but human rights of future generations. Can we argue from a legal, philosophical, political, philosophical perspective that future generations who are not yet born also have human rights? And what would that mean in terms of obligations, current obligations of states, in light of the depletion of natural resources, the risk of nuclear incidents, or things like that, climate change, greenhouse gas emissions. And that also means that we have to define the notion of sustainability, not only from an economic perspective, but also from other perspectives.
Thank you so much for your presentation. But I'd like to ask you, how do we lobby for governments to implement, for example, basic essential healthcare? Because we cannot talk about it for all if we haven't yet even made essential healthcare packages to access, for example. But I come from an Australian here, and I see that when you travel more than 100 kilometers just access delivery systems, and you have things like ARTs or stockpiles, like HIV medicines, failing out, and basic systems. So how do we ensure that governments are accountable based on this?
Yeah, how do we ensure, if I understand your question correctly, how do we ensure that governments are being held accountable for issues like these? In my view, what I would suggest, what I would very much prioritize is this bottom-up approach, so that local people organize themselves, local health committees, for example, organize themselves, use the international documents, the goals that your government has accepted, also use the human rights treaties that your government has accepted, try to translate these in specific issues that are of your local concern, and then go to your local municipality, your local governmental authorities, and ask them, well, here are the documents that you have accepted. Even local governments should know what the central government has acceded to, has adopted, has agreed upon. These central governments have an obligation to translate in specific and concrete terms what these obligations would mean for the local level. And then you can use this kind of information to hold local decision makers accountable. This is, maybe it works like this here in South Africa. At least in the Netherlands, it is slowly starting to move into that direction, using international documents to involve people and holding local decision makers accountable.
I don't know, David, if there is a PHM in Malawi, for example.
Yeah, PHM.
The movement might be active in Malawi.
Yeah.
That might be a way to organize.
Yeah, there are a few people we have contact with.
Yeah.
So,
Not only
pass the information around.
Yeah, yeah.
you are surrounded by people.
If I can just go back to David's question, you mentioned responsibilities and obligations.
Yeah.
I wonder if you could just tease out the difference
Okay.
and what it means for this question about who does what.
Okay, who does what? So as I said, obligations are laid upon governments, and that means obligations means legal duties. You have voluntarily accepted this obligation because your signature is put under this document, and that's a legal obligation. It's similar to a contract that you sign. So treaties, human rights treaties, are contracts between states. It's legally binding, and that means that you have obligations and that you can be held accountable for this. And that applies to states and provincial government and local government, because these are all state agents. Responsibility is a less legal term, and that is usually applied to hold other actors accountable, such as corporations. Corporations in international human rights law do not have yet obligations, but they have responsibilities. And that means that you at least can approach these corporations and ask what they have done to implement, for example, their own code of conduct. Many companies today have codes of conduct, but they are still voluntary. There are discussions, or there have been discussions within the UN to strengthen the responsibilities of business corporations. These are the so-called RUGI guidelines on business and human rights. That is what lawyers call a soft law document. It's not legally binding, but these RUGI guidelines provide guidance, directives for how companies can be held accountable. They have responsibilities, not obligations. And another more recent development is, where also South Africa is very much involved, is that South Africa and Ecuador have suggested 2 years ago, within the framework of the United Nations, to draft a treaty which would impose legal obligations on corporations. So that, for example, corporations should not be involved in practices of corruption, trafficking in people, pollution, degradation of the environment. That would go one step further than only responsibilities. It would impose obligations. And you can imagine that this has been very much not well received by governments and corporations. They are very much opposed to it, because it would very much limit their operational freedom if companies would be bound by legal obligations during their, let's say, their operations abroad, especially transnational obligations. So what we have today is only responsibilities, which is weak, but it is at least something.
We can, as in terms of kindness away with the Secretary of Kindness Secretary, we can bend the political will that is required to accept and translate the regulation SEG into matter of implementation. But is there any legal help that we can get as a clinic? I mean, maybe we can get a project or a program that can empower us. Because these things that are now we are here, the manager, the CEO of our facilities, they are every day, daybreak that they are practicing. Mm-hmm. Whereas for us, we are elected as just committees. We are not involved. We are not trained as they are trained. Is there any legal help that you can get for this can be implemented in our facilities? Yeah. Because if you are not trained, it will be like a giant against a dwarf fight. Yeah.
Well,
tomorrow I can say something.
Okay, yeah, go ahead.
Tamara also from College. Currently, we are based as College Health Committees. We have initiated to have a health summit based on the fact that we get so much complaints from e-patients. Right. That there's the service delivery around health is poor in College. So we've taken up a decision of having this health summit. The agenda that we have proposed as health committees was to get the status of health. What is the status of health in College? But now that I'm here, I think this document will assist us as well in coming up with a topic for discussion. Because on a serious note, you cannot just discuss health, yet you've got a crisis of people that are not working. You've got a crisis of the crime. You've got a crisis of substance abuse that leads to all these challenges that we are facing. So again, it's going to assist us, the document, and yeah, it's going to help us a lot. Another question, we have participated on it's now an act, it was a bill then, where the minister of this province proposes on appointing people to serve in the clinic committees. Yet, as communities, we feel that we want communities to elect people to serve in the health community. Now, that process, we've done our submissions, went for a match in town. But again, still, what she says will happen. How do we get e-assistance being made from the legal team to make sure that what we want as communities, because when we give the community an opportunity to elect people that they know, so that there will be an independent structure than be a governmental structure, you know. Not to say that we don't want to be a governmental structure, but being an independent body gives you more powers. No one can control you, you know, or tell you what to do, you know. So now that in the Western Cape, she has started the process of appointing and announced for people to make applications. You know, we took a decision that we won't apply. We will remain being these health committees. We will hold our facility managers accountable when it comes to health. But then we also feel that we want to go the legal route. You know, are there possibilities that maybe there's an institution or an organization that can assist us in championing that?
Well, I think, and I remember that a few years ago we drafted this toolkit. The toolkit on the right to health. I'm talking about in terms of training. So how can we use legal tools? So there is a toolkit available.
So I think the question is also about the obligation. Well, two things: the obligation for capacity building. So if you have the SDGs and you have these comments that say there should be participation, is there a legal obligation in the state to build capacity, to put resources into building capacity? And I think tomorrow's question is specifically around this issue. Is there a way of getting legal support for a court challenge or some legal challenge?
I don't think that you could say that there are legal obligations that would impose on the government an obligation to assist, let's say, local organizations in going to court. So legal aid, legal assistance is always that's to provide legal assistance, legal aid, is not an obligation. It's something that is still voluntary. However, you could argue, well, if this is not provided to people who need it, then human rights as such would mean nothing, because you need this kind of extra help to claim your rights. But I don't think there is a legal obligation now. But the point that you make about, let's say, participation and the importance of elections, that's a key issue. So participation, of course, presupposes that there is some kind of democratic organization supporting this. Otherwise, it makes no sense. And indeed, you need to be independent and not composed of members who also have a different header.
So we'll take the last comment from David, because we ran out of time.
So I'm no expert in this, but you or Leslie or Louis could perhaps answer this, which relates really to the question that the colleague from the Health Committee asked. So my understanding is that the South African Constitution guarantees the right to health for all its citizens, and for children, the right to health now, basically.
Yeah.
So, in thinking about, in other words, although the right to health of all citizens depends on the available resources, etc., the government has an obligation. For children, the response needs to be immediate.
Yes, the obligation is stronger.
So, it would seem to me that if there are campaigning issues for us, which could actually really hold government to account, we could identify health problems that particularly affect children. Of course, they affect the whole community. But, for example, we know that in Khayelitsha, young children are getting diarrhea frequently because sanitation is very poor. So that is, as I understand, infringement of South Africa's constitutional obligation. So I think we could think of ways of actually pursuing the right to health in a very concrete and urgent way. So I'd be really interested in the comments of colleagues on that, including people from Khayelitsha.
Can I just answer David in one aspect of it, Section 27, which is everyone has a right to healthcare services that has to be implemented progressively according to resources. Section 28 says that children have the right to basic healthcare. There's a difference between healthcare services and basic healthcare. And as I understand it, although they've had that right for more than 2 decades now, the hold-up is there is no definition of basic healthcare. Now, whose obligation? Who has to come up with that definition? Is it the state? Is it the pediatric community? Who has to define basic healthcare so that the state can become obliged to deliver on it? That's my understanding.
Is it true that there is no agreement on what basic healthcare? Also at the international level? So
it's not a language used internationally. It's used here to distinguish access to healthcare from children's access to basic healthcare. Or in fact, children's basic healthcare.
There's a case that's been to the Constitutional Court about the right to basic education, which was won by the people who brought it to the Constitution. But for some reason or other, we've spoken to the Legal Resource Centre about this very issue. And they didn't seem to think there was a legal case to be made about the right to basic healthcare. I'm talking about this in relation to placing in Cape Town where the mobile clinics were taken away making healthcare very inaccessible
Yeah.
after the constitution was promulgated. So there's a problem there of rolling back human rights in the community. And also children there, they don't have access that they used to have. Even under apartheid, they don't have that access.
So I think there isn't an easy answer to this question. I'm aware we're running out of time. So if I understand, there have been two issues raised, which is that the Khayelitsha Health Summit might benefit from a discussion about the SDGs, and maybe we can talk afterwards about how we could do some workshops first with the committee and then see how it could get onto the summit. The other issue is about the health committee not being elected, and maybe is there a legal case, and maybe we can find some organisation can support. And this third discussion about leveraging the right to basic health care for kids has sort of got a bit stuck, and maybe we should pick it up again going forward. Okay. I think we need to wrap up because we've gone over 1 o'clock. Thanks everyone for coming and for staying over time. And thanks to Fons very much.
Thank you.